is there a large amount of special needs children in the
Yeah.
foster care community?
So one of the things that's really interesting, Jamie, is that oftentimes kids that have been through trauma have a lot of sensory needs.
Mm-hmm.
So actually, in this area of the state, we see a really high diagnoses rate of kids that are within the foster care system that have been deemed that they're somewhere on the spectrum.
Right.
And so like that's a high level of need, and that can cause people to think, oh gosh, I can't be equipped to care for this child. But the reality is that, and you know this from the work of your family, those resources are really hard to come by.
Yeah.
But if we can know that a lot of those sensory needs come from trauma-informed care is way easier, way less restrictive as far as insurance and all that stuff
Right.
than a pure autism diagnosis. And so a lot of the work that we're doing now is trying to create trauma responsive communities to say, this is what trauma looks like. And yes, you might see this sensory profile or needs in a child, but that doesn't mean that we need to go a full-fledged, we need all these services. What would it look like for the school teacher to understand trauma, for the school to be able to meet sensory needs and help with regulation? And you know that is a challenge.
Absolutely. Working in, yes.
Yes.
I have a lot of family experience with that and a wife who fights that battle on a daily basis.
She is an advocate, as an advocate can be. So, yeah.